Hello everyone. Today we discuss creation of an assessment plan for a course, a module, or a rotation. And here are the objectives for today's session. Take a minute to take a look at them. Thank you. Let's begin with a definition. Note the keywords have been highlighted here. Throughout this course, key ideas will be in bold colors to help you more clearly understand the content. This definition describes the goal of assessment blueprinting and is very important to get your mind around. If you have any questions about this, please take some time to contact the assessment specialist. This example illustrates what an assessment plan for a simple knowledge-based task would look like. We will go into more details about each decision that was made to create the plan in the next slides. To complete an assessment plan, you first review the topics and learning objectives that are created by the development teams, and then fill in the appropriate column. You will rank the topics and related session-level learning objectives in a sequential manner. Topics and objective sequences are recognized by serial numbers associated with them. Please note that in the final document you will use the numbers as seen here in red, not the full objective descriptors. The second step is to recognize the CanMEDS roles. CanMEDS roles are the program goals which are adapted into our comprehensive curriculum document. More attention may need to be made to non-medical expert roles to see how they can be incorporated into teaching and assessment. In this case, though, only medical expert is expected for these particular objectives. There are 6 competency levels. Knowledge and comprehension is the first level of competency, and it tests students' understanding and memorization of facts, concepts, principles, and procedures. Application is the second competency level, testing whether students can use what they have learned on new material or in new situations. Analysis, synthesis, evaluation is the third level, testing students' critical thinking or problem-solving skills. Attitude and affective as the fourth competency level tests students' motivation. Shows how is the fifth competency level, testing students' performance in OSCE stations or high-tech simulation. Does is the last level, testing student performance in real clinical situations. In this illustration, only basic comprehension is expected because of the objectives. The fourth step of assessment planning is to determine which types of assessment will be used in your course, module, or rotation. Common types of assessments have been included here. However, you may design other assessment types that are not listed. Assessment components are shown in blue, implementation dates in green, and estimated weights for each type of assessment are in red in the example here. The last step in assessment planning is to select appropriate tools for an associated learning objective, and then use them in midterm, final exams, or assignments. As you can see by the list provided, there are at least 9 common tools that you can use to measure the associated learning objective. Each tool has its own advantage and disadvantage and has special comfort zones in testing a competency level. You may review the assessment tools template to figure out the competency level that an assessment tool intends to measure. In this illustration, because the objectives include the verb describe, which is a comprehension task, MCQ exams would be the best choice. To practice what you learned from this session, you may take out your topics and related learning objectives file for a course that you teach. Then create an assessment plan by following the assessment planning steps. Begin with the template on the following slide. Thank you. That ends our session on assessment planning. Take a look at the other ones that we've provided you for more information about blueprinting.